Spicy foods does not cause ulcers. Ulcers come from an overproduction of acid in your stomach. There are medications to treat that, and while spicy foods will aggravate the symptoms a little bit, it does not actually cause the ulcers to form.
Welcome to VNA Today. I'm your host, David Miranda. Many of us have a loved one whose life has been affected by breast cancer, but do we know the warning signs of the disease? October is Breast Cancer Awareness Month, and VNA Healthcare's Asaida Mondragon Manny is joining us to talk about the symptoms, testing, and treatment.
There are two types of breast cancer, and they are ductal carcinoma, which is where the cancer originates in the ducts of the breast and then can spread to other parts of the breast or other parts of the body. And then lobular cancer carcinoma, which is where it originates in the glands or in the lobules and can also spread to other parts of the breast and parts of the body as well. Some warning signs to look out for include any masses in the breast or in the armpit. Also any changes to the skin, so skin dryness, itchiness, flakiness, pain in the breast or around the nipple, any nipple drainage, also any skin dimpling or pulling of the nipple as well. Patients should start routine testing at age 40. And depending on their risk factors, it can be annually or sometimes biannually, but they are recommended to come in every year for a well woman exam. And from there we kind of determine how frequent they need to get mammograms, but mammograms begin at age 40. You can do self-breast exams at home. They wouldn't replace like the exam you get in office, but they can sometimes help guide us if you notice something at home that maybe we should take a closer look at. But definitely still come in every year for your well woman exam. We start with the manual exam in office, and that's just to kind of get an idea of any areas of concern. From there, you are scheduled for a mammogram, which is essentially like an x-ray of the breast. Some women do need further testing, for example, like ultrasounds or MRIs, especially if they have increased risk factors or dense breast tissue. Ways to treat cancer include surgery to remove the damaged or cancerous tissue. You can also have hormonal therapy that'll help prevent the cells from getting the hormones they need to keep reproducing. There's also biological therapy, which helps your immune system fight off the cancer. Some people need chemotherapy, which is therapy to eradicate the cancerous cells, and you can also do radioactive therapy, which is targeted therapy also to help get rid of those cancerous cells. Risk factors for breast cancer include your age. They do find that most women get diagnosed with breast cancer after the age of 50. Other things could be like family history, if there's a genetic mutation, for example, like the BRCA or BRCA1 or BRCA2, you could be at increased risk. Also, having your period like early or going into menopause late are other risk factors that can put you at higher risk for breast cancer. So the BRCA1 and BRCA2 genes are genes that typically help fight off cancer. So if there are any mutations to those genes, you could be at increased risk for developing breast cancer. It is really important to look at your family history and talk about that with your provider to see if you might benefit from getting genetic testing. Some risk factors you can control include maintaining a healthy lifestyle, so make sure you're exercising regularly, eating healthy foods, try to limit your alcohol consumption if you can, avoid it altogether. If you're able to breastfeed your children, women who breastfeed are at lower risk for breast cancer. And also just talk to your provider about any family history, or if you're thinking about going on hormonal replacement therapy or any other medications that could increase your risk. Some ways you can support somebody who has been diagnosed with breast cancer. It could be as simple as just being there for them, having you there as someone they can rely on, or have a shoulder to lean on. Sometimes they might need help with like daily activities, so like chores or running errands, going to their appointments, so just being available for them. And sometimes it's hard for people to ask for help, so instead of asking, like, let me know if there's anything you need, just volunteering to help with some of those things can be helpful. Here at VNA, we can help by providing some of those preventative screening services. So coming in for those well woman exams, we do have a mammography department here. They're really good about doing some of that follow-up if needed, also if they do need, biopsies or other things. So starting here with your preventative health services is a good place to start.
Thank you so much, Saida. To make an appointment or learn more about the services offered by VNA Healthcare, call 630-884-4566 or online at vnahealth.com. It's time to trick or treat. Join us on Friday, October 28th from 4 to 7 p.m. for Halloween fun. There will be hot cider, hot chocolate, cider donuts, and a decorated tent contest. The Halloween Fest will take place at VNA's Highland location. Make sure to follow us on social media for more information. I'm your host, David Miranda. See you next week.